New study published by Lancet Global Health revealing that asymptomatic infections are important drivers of influenza transmission. The research evaluated the community burden and transmission of the flu from 2017 to 2018 in a rural and an urban South African community. So what does it all mean? What does it tell us? Well, Professor Cheryl Cohen, head of the Center for Respiratory Diseases and Meningitis at the NICD, will make sense of it all for us. Prof, a very good morning to you. Yes, so what have we learned from this survey?
So good morning, and thanks for having me. I think really, our study was probably one of the most intensive studies that's ever been done of influenza burden and transmission. And really what it showed is that seasonal flu, that's the normal flu that comes every year, is much more common than we used to think. So we found that 3 out of 4 households had at least one person with laboratory confirmed flu each year, and that 1 in 3 people also are catching laboratory confirmed flu each year. So it's really, really very common. Importantly, though, we also found that of all these people who are catching flu every year, only about half of them have symptoms. So there's really this huge burden of flu that is coming every year that is not being seen, and people are not necessarily getting sick. But we did also find that although these people without symptoms transmit less than people with symptoms, they can still spread it to other people. So we found that if you have flu and you've got no symptoms at all, you can still infect 6% of the people in your house. So really, I think what our study showed is this really huge, enormous burden of seasonal flu, and the fact that a lot of the transmission and the spread in our communities is really happening beneath the surface. And it's really because of our intensive study where we swabbed people twice a week and tested it for flu that we were able to pick up this asymptomatic flu, because we were testing people even if they looked perfectly healthy.
All right, well, that's very, very fascinating indeed. So what does it mean now in terms of COVID-19 and what we need to learn from this and take from this?
Yeah, so I think, this study was originally done to look at seasonal flu, and that was important because, we know that about 10,000 people die of seasonal flu every year. Again, most of these are not tested and diagnosed. And we wanted to look at the asymptomatic burden. Now that COVID has come, I think it's very clear that COVID has even a higher proportion of people that don't have symptoms compared to seasonal flu. And one of the big outstanding questions is how commonly can these asymptomatic people spread flu, and how common is asymptomatic infection? So what we've actually done starting last year is, following on our flu study, we restarted that study, in fact, in the same rural and urban community where we did our initial study with funding from the United States Centers for Disease Control and Prevention. And we've been monitoring, in fact, households in a rural and urban community since July last year in the same way to try and answer the same questions for COVID. In other words, how common are people infected with COVID that don't have any symptoms, and how important are these people in terms of the spread of COVID?
All right, so what you found there is that the flu incidence risk, Prof, being similar in rural and urban areas. So what is that telling us in terms of access to facilities, access to health care as well? It doesn't matter because you're suffering the same way.
Yeah, so I think that's really, really interesting, right? Some people think that if you're in a rural area, people are spread out, there might be less flu in the rural area compared to crowded people in an urban area. We found exactly the same amount of infection in the rural and the urban area. So a third of people were getting infected in both sites. And I think that's really important, as we think about, it means that this virus is really spread everywhere, and it doesn't matter where you are. But of course, we know people in rural areas may have challenges in terms of accessing healthcare, and so we might even underestimate the burden more in rural areas. I think importantly, though, the same may not be true for COVID. So I think emerging data suggests that for COVID, there can be what we call heterogeneity of the burden. So different areas can have less impact and more impact over time. And I think there's emerging data to suggest that in South Africa, certainly at the beginning, the rural areas may have been somewhat spared, but we don't, given our flu data, we don't expect this to last. So the virus might take longer to get to some communities because they're less connected. But overall, it's likely that the attack rates in the end will probably affect all sectors of our society, whether you're rural or urban, and our flu data certainly suggests that.
Very interesting indeed. Thanks very much there, Professor Cheryl Cohen, making sense of that study for us.